You. Now, we've come to our last question that we're asking you today, Jess, and then we'll be handing over to you for our newly added segment there as well. But our last question for you today is, what can students applying for medicine next year, or any students, I guess, who might possibly be on a gap year, what could they do to start to prepare themselves for that application process?
Yeah, so I think when applying for the when preparing for the application process, the first thing I would do is sit down and kind of write down everything you need to do. So applying to medical school is a long process. There are hurdles you need to jump through, as I mentioned before. You've got to do personal statement earlier than everyone else. You've got to do the admissions tests, and you've got to also understand that you will be invited to interview before you get given an offer. So it's different from a lot of courses. And that already means you have to start early. So I think the summer of that year that you want to apply, I would think April, May, June, you should know exactly what's expected of you for the next few months. The first thing I would probably focus on is admissions exams. So the UCAT is one exam, you take that in the summer and September, and then you have another exam that takes place in November. Your personal statement obviously needs to be done at the end of October. So again, by writing this all out, you can then schedule what you need to do, but admissions tests need to be your number one priority because these are requirements that have a deadline that need to be done. And once they're done, then you can apply. I'd sit down with myself and start writing my personal statement sometime in August. And this is brainstorming. Why do you want to do medicine? You need to have that answer cemented. I mean, you need to have some key points as to what really draws you in about this career and this degree. Is it the lifelong learning? Is it some work experience that you've done? Is it that you love to rise to a challenge, and why? How have you shown good teamwork? All of these sorts of things that they're obviously going to ask you at some point, you need to be thinking about. And you need to that will help you draft your first personal statement, because that will go through a lot of edits. Make sure you send that round to people. Whoever will read it, get it out there, and be willing to take on criticism, as harsh or as nice as it is. I think the harsher the better. So I'm quite harsh, but in a good way, as in like, delete this, not needed, completely rewritten stuff. Everything's in red, but it'll help you. You'll see how much your personal statement changes. And then once you've kind of ticked off admissions tests and personal statement, it's technically all about interview. And before you even get to this stage of application, work experience. You can never have too much work experience. And I think try and find work experience where you're really involved. You're part of the team. You're seeing people. You're talking to patients. I'm not asking everyone to get a job as a healthcare assistant, but what you can do, like even before I was a HCA, I did work experience at a hospice. It was only 5 days, but a hospice is where people go to die. So it was such a totally different side of medicine, because I saw what it was like to be a doctor who couldn't do anything. You know, you had to know your limits. These people are going to die. What can I as a doctor do? You can control their symptoms, you can make them comfortable, and you can be empathetic and compassionate to family and friends. And I think being in those last moments of people's lives taught me so much more than the 2 weeks I spent in the hospital. You know, so think about where you can get work experience. It doesn't have to be at the hospital, like we were mentioning before. Dip your toes in other things. Working at a nursery is just as, you know, it will give you skills, believe me, that will make you adaptable and give you communication skills and all that sort of thing. So yeah, go far and wide with your experience. You can never get too much, and then make sure that you plan out the hurdles that you need, the tick boxes that you need to check as you go along the year. But summer of that year, I would start.
No, thank you. And that's so key, because even like you're saying about like planning ahead, is that, you know, we've all been probably saying it, that it's crazy to think, you know, that we're at the end of 2021. And I know, like I literally was telling people yesterday that for me, I was thinking there were deadlines that were due in December, and I was thinking, you know, December's not that far. You know, we've got a few weeks left. And then literally I was like, no, I've got one couple next week and then the week afterwards. And it's like what you said, that we have to be able to like plan out stuff. So we know that like, this is actually 2 weeks from today. So what do I need to do? Like, why do I need to be a week from the deadline? Where do I need to be 2 days from the deadline? On the morning of the deadline, what do I need to be to know that I'm happy with it? And I think that's definitely key. But also, like you were saying, that like work experience, I think, like you said, even like generally, not even just for healthcare, anyone who's, I guess, looking to apply to university, like work, like you said, work experience, essentially, there's nothing wrong with whatever you get, because like a lot of people have probably seen, there's a lot of transferable skills. So whether you're, like you said, working on a hospice or working with kids, you're learning how to communicate to an audience who it's not the same experience for both of them. With children, you have to be, mindful of the words that you're using. I know with my placement that we were working with both primary school and secondary school children, and we were doing workshops with them. So I had to be mindful of, I can just probably tell a secondary school student, here's like the worksheet, go ahead and do it. But with the primary school, you have to be more careful of even within the primary school. So year 6 might be more confident and just be like, yeah, I can do it myself. I don't need your help. But year 2 might actually be like, no, I need a bit of a nudge. Can you tell me what's the direction that I should go? Or they might ask you a lot more questions. And it's always great because with children, it's always funny to see their reactions when you do stuff like that, because when you show them this is how you're supposed to do it, young children, it's like their minds are blown. You might as well have just showed them, £50,000. You get the exact same reaction. So I feel like you said, having that work experience is just really good. And it shows also that you're doing more than the average, because you're not just essentially I guess coasting through university or even coasting through sixth form or college. You're showing that actually I'm going out and I'm doing stuff, whether that's working at Waitrose. I know Waitrose love to work with young people. I know a lot of my friends worked at Waitrose, whether it's working in retail, you're gaining these skills that even long after you've left that industry or that job, that you'll still be using. You'll be using the networking skills that you have in retail, and things like that. So yeah, I definitely think that both of those advice are very key. Even like I said, not just for students looking to do healthcare or to do medicine, but anyone who's applying for university or even for a job, if you graduated or you're applying for anything like that, these are all very key. So thank you very much for that, Jess. And we will now go on to our newly added newly name segment. I know last season we didn't have an official name, but as I promised, we do have a name. So our new question for us segment is officially called Passing the Mic. And today, Jess is our first, I guess, official Passing the Mic guest. So as always, you guys know that Passing the Mic, as it's now called, is about passing the mic over to our guest speakers. So our guest speakers will be interviewing us as a team, and they'll be asking us questions, whether that's related to the topic or more general, or just to know a bit more about us. So I'll now officially pass over the mic to Jess so she can ask the question.
Sure, thank you. So my question to you is, what made you start a podcast on the topics you've decided upon, and how have you ensured that it inspires your target audience?
So as promised, I did say at the start I would talk about it. And essentially, so this podcast started because I applied literally this time last year to be the BME officer at my university. And I didn't get it. But I thought, hey, that's fine. I'll move on. And one of the things that I saw is that a lot of students don't know a lot about things, especially uni students, don't know a lot about the resources available to them at the university. So I know one of the things that was part of my manifesto was I was saying, hey, look, I want to highlight placement. I'll get relevant placements for students, because I know that sometimes when the university is emailing you about placement options, sometimes it feels like, yeah, this is for the general college or for the general course, but this doesn't actually help me as an individual or as me as a course. So I wanted to do that. And I know a lot of students were just I actually don't know where to look for placements. They were saying, I'd love to do a placement for the summer or for the year, but I don't know where to look. And yeah, one of the things I felt also is that support services, whether that was on campus for mental health, or whether it was just jobs or anything like that, a lot of students actually didn't know that there's stuff on campus that can help them. So whether they want to start up a business, I know at Brunel, there's an entrepreneur hub that helps you to start a business. Whether you want to, build up your CV, there's a place on campus that will go through your CV with you and they'll give you advice. Now, I was lucky that my course heavily involved these people throughout my undergraduate. But I know that there were a lot of people, both through my undergraduate and literally on my master's, that didn't know a lot about this stuff, whether it was because, you know, they didn't live on campus, or they weren't always at lectures, or even just because like their course is so big that their course doesn't have time to like dish out this information. Was one of the things that I saw, and I was just like, no, you know, we need to have a space for this. So me and a couple of my friends, we all just decided that, you know, it'd be really good to have a podcast that can talk about these topics, you know, bring on guests like Jess today, and just talk about, you know, things like that I guess are personal to us. And we were saying like we've all got different experiences and different journeys. We've all been through the education system and at different points. So we were saying that it's really key that even as a team that we've got our own stories that might help someone else. So whether that's, you know, like my friend Samuel, he specializes in mental health. So he talks about like all the mental health services that he was working with at the university that some people didn't know about. My other friend, Nanushka, who also helps on the podcast, she specialized in doing like biomed. So she was talking about like how she, like with all the things she's been doing in biomed and learning about medicine, and how she changed, I guess, from what she wanted to do. She didn't necessarily want to go into medicine, was a research assistant. So things like that, I think, are just the main reason. And to, I guess, ensure that, you know, it inspires our, I guess, target audience, is we always just, I guess, do topics that we feel that is relevant to young people, or to people in general. So I know, for example, you know, we've spoken a lot about like race. Race has been a very important thing that we've spoken about. We've spoken about it through different lenses. So whether that's how does race affect mental health services, or how you're treated at mental health services? How does, you know, is there diversity of representation in STEM as a whole, in different fields within STEM, you know, in schools, things like that. So we try to do topics that like are very relevant for the people that I guess our target audience, which are whether they're university students or young people, that they'll know that these are very key. Like these are key subjects that they should know about, because a lot of the time, like even, you know, growing up myself, you know, you didn't see a lot of representation. So essentially we're just using that to just help raise awareness about these services that help, you know, help students or young people, you know, things that students might not necessarily know from the get-go. It might help them with an informed decision about their university applications, like the advice you gave today, Jess. But yeah, essentially things like that is just what helps us to, I guess, keep knowing that, I guess, people are interested in the content we're producing.
Awesome. And I think the last question I had was how you select your speakers.
Oh,
like, what do you look for in a good speaker?
That's a very good question. I would say that we with all our speakers, whether they're people that we've known or people that we've seen their accounts on Instagram, or LinkedIn or anything like that, all our speakers, we look for people that are inspiring, I guess, the next generation. I like to think of them as innovators of the future, essentially. People who are doing like creative work, whether that's like the work you're doing, Jess, through talking about, you know, your own personal journey of what going through medicine's like, whether that's with other people that we've had on who are students that are going on placements or been on placements, or students who know a lot about environmentalism and environmental sciences and things like that. It's all about getting people on who we think that, you know, are inspiring the next generation. And even if they themselves, you know, might not think what they're doing is inspiring the next generation, or that what they're doing isn't a lot. You know, these are people that are very passionate about the topics that they talk about. And that's the key thing that we say on the podcast is, you know, we as a team could talk about some of these topics, you know, from things we find on the internet or things we research ourselves. But at the end of the day, you know, some of these topics we don't know a lot about, or we haven't experienced ourselves. You know, I'm not in the healthcare industry, so I know not a lot about it. But having guest speakers like yourself on who are passionate about it, when you're talking to someone who's passionate about a subject, they're always going to portray it and like speak about it in a way that's better than someone who's not. I could talk about the environment for days. But, and like my friend Samuel could talk about mental health for days. But the thing is, there's only so much I know about mental health from whether that's my personal experience or things that he's told me. But he could talk about it from all the research he's done from his undergrad and his master's. He can talk about it from the work that he's currently doing. So that's, I guess, the best way to describe it, is that they're all, including yourself, individuals that are doing this like amazing work that we want to highlight and just show. Even as simple as like you're all doing stuff that you want to do. You're all following, whether it's someone is a gamer or is into YouTube or is content creating. They're all doing things that you're happy with. And I guess we want to show that to people as well, that, you don't need to feel like, your 9-to-5 job or your degree defines you. You can do you could I don't know, have done mechanical engineering, but your main source of income could be that you started a Twitch streaming service and you play games on the side, and now it's popped off and now you've made money from it. So yeah, that's essentially how we pick our guest speakers. So yeah, hopefully if they're listening, they're all happy with what I've said.
Thank you.
No, you're welcome. And yeah, I guess going on to guest speakers, that nicely leads on, as always, to our MC of the Month section. So for any new listeners or for anyone who may have forgotten, our MC of the Month section is always about individuals or organizations that are doing amazing work related to the topic that we're talking about today for that episode. And for today, we were lucky, literally last episode of season 2, to have Ebun from House of Medics. And, she briefly talked about it there, but House of Medics are our MC of the month for this episode. Now, for anyone who doesn't know or didn't see that episode, no worries, because I'll be explaining to you. But I definitely would recommend, so you can find out more about them from someone who works with them. But essentially, House of Medics are a group of professionals who either work in the healthcare industry or are very passionate about healthcare. They've got a wide range of members. So those include doctors, midwives, nurses, pharmacists, radiographers, mental health professionals. The list literally goes on. But they were founded, and I think it's really nice, is they said that most of them weren't passionate about traditional professional bodies anymore. And they felt that, when they discussed it with their colleagues, many didn't feel the same way. And as they say on their website, that a lot of these like professional bodies and societies were originally social constructs that acted as support systems for their members and provided a sense of belonging. And they wanted to bring that back to medicine. But they also said that there's a lack, or they saw a lack of opportunity for young people of different specialties and disciplines to genuinely interact and get to know each other. So they said each Royal College caters to the small group of people, which of course, is good and has advantages. But since they all work together, they believe that, House of Medics, but also, I guess, on a side note, any industry really is multidisciplinary, and we work with all these different people. And yeah, they do amazing work. They have a great mentoring program, which pairs aspiring students with those who have already, completed or are very experienced success, essentially, in their chosen fields. And what I really like is that they as an organization are very diverse, not only, I guess, job-wise, but as people. And I think that's the key thing to highlight, that, like we were saying before about representation, brings that understanding, eliminates that bias. They all come from different fields and different backgrounds. And they too, I guess, get to learn and show, this diverse field of medicine. So yeah, those are our MC of the month. Feel free, their website will be on our website, but they've also got an Instagram page, which I believe is We Are House of Medics. But like I said, if you do want to, I guess, listen to someone who's been on there before, please do check out literally the last episode with Ebun, but also, as an organization, they do a whole host of events. So if there is anyone listening who is interested in going into healthcare, please do check out their website. At this point of recording, they did a winter networking event, which went really well. But I know also they do other events during the year. And they've said, Ebun said when she was on, that they're happy to answer any questions. If you send them a DM or an email or anything like that, they're happy to, give you advice or pair you up with a mentor if you're looking for one. But yeah, those are our MC of the month. And we've now come to the end of today's episode. It's been great to have you on the podcast, Jess. We really enjoyed learning, more about you, more about healthcare, and I think most importantly, more about why it's okay to fail and to not let failure define us. So thank you very much.
Thank you so much for having me. It was an honor.
No, you're welcome. Now, before you go, I guess some of our listeners might be interested in, some of the services that you mentioned that you do, such as personal statement reading. So I guess where could our listeners go to find a bit more about you and to get in contact with you?
Sure. So my main website is progresswithjess.co.uk, and that's where I post everything about med school. And also you can apply to my mentorship scheme, which opens every summer, which is when you get one-to-one support from me and any other medical student peers that I know to help you with your application to med school. So this is basically whether you're in secondary school, a gap year, or a graduate hoping to get into med school. If you want to follow my life, jess.olo, O-L-O, is my Instagram, and jess.0lo is my Twitter. So, and LinkedIn, Jessica Olopon.
That's perfect. Thank you very much, Jess. And please do get in contact if you are interested in the medical field, because as Jess has clearly shown, she's doing a lot of work. And I guess some of our listeners might even be interested in your book, Jess. So if they are interested in your book, where should they go for that?
Oh, thank you. That's progresswithjess.co.uk/shop. And that is if you're interested in relocating abroad to a different country. There's 12 different countries on offer. You can have a browse, have a look. And I also have an Instagram live series with doctors from around the world who have left the UK to go abroad, or who have left other countries to go abroad, and how they're finding it basically, and similarities and differences with the UK.
Well, thank you very much for that. And like I said at the start, it's like Jess is doing everything. So, you're not missing out if you do check out, her website and connect with her. Thank you very much, Jess. Thank you very much to our listeners. Like I always say, if you like this episode, like and subscribe is always appreciated. Click the notification bell so you don't miss the next episode. And if you are interested in becoming a Patreon member, click the link in our bio so you can get early access and more prizes as well. Thank you very much, Jess, again. Thank you very much, listeners. We hope you're doing well. And keep an eye out for the next episode of Pick Up the Mic.